welcome to our first Node webinar for 2021. And this, I promise you, this is not going to be the last one this year. So this is the first one. First of all, I'm Gracia from Waseda University. I'm from Institute of Asian Migrations at the Waseda University. And this Node project, I want to say a little bit about this Node project that it's a joint project between the Institute for Research into Superdiversity at the University of Birmingham, led by Professor Jenny Phillimore and Nando Sigona, and with the Institute of Asian Migrations at the Waseda University. It is funded by ESRC, UK-Japan Network Fund, and also Japan Foundation grant. And we have been having a lot of activities together, but because of the Corona pandemic, we took a pause, for conferencing and events for almost a year. But we have been collaborating on a lot of writing projects during this year. But we decided we would take this opportunity to actually convene virtually, so we can have a workshop, a joint workshop between ARIS, Institute for Research into Superdiversity, and the Institute of Asian Migrations. And today, today's event features two speakers. One is Dr. Laurence Lessard Phillips from University of Birmingham. The other is Dr. Jotaro Kato. This a joint workshop tries to explore the impact of COVID-19 on migrants with precarious legal status in the UK and Japan. And today's talk will discuss the impacts on COVID's impact on the vulnerable migrants. So without further ado, I'll invite Dr. Lessard Phillips to give a talk. And Dr. Lessard Phillips is a senior research fellow at ARIS. Her main research interests lie in the perceptions, measurement, and dimensionality of immigrant adaptation, ethnic inequalities in education and the labor market, the transnational behavior across immigrant generations, and social inequalities and social mobility. Her today's talk is vulnerability and the migration during the pandemic in the UK, a well-being perspective. So Dr. Lessard Phillips, please go ahead.
Thank you very much. So welcome everybody to this webinar on and where I present some work on vulnerability and migration during the pandemic in the UK from a well-being perspective. And what this is part of a project with some colleagues at the University of Birmingham and Doctors of the World UK, funded by the Nuffield Foundation. Okay, so, So when we think about vulnerability and migration during the pandemic in the UK, especially with regard to a well-being perspective and populations most at risk of vulnerability, which include undocumented migrants and asylum seekers and refugees, is that the impact of COVID-19 on the health and well-being of disadvantaged and excluded people has led to an exacerbation of existing health inequalities. And what we are seeing from the policy literature, as well as the emerging academic literature, is that there's more evidence coming out of this. But as part of this project, what we're trying to do is to provide more evidence with a focus on undocumented migrants and asylum seekers and refugees by providing some analysis of data from Doctors of the World UK that they have about the service users. Doctors of the World UK is an organization, a non-for-profit organization, and one of their aims is to provide healthcare for all and to campaign for healthcare for all. And and they have data based on the clinics that they run, and I'll explain that a bit further. So this, as I said earlier, this project is funded by the Nuffield Foundation and by the University of Birmingham's ESRC Account Acceleration Fund. And it is a sub-project of a bigger project that uses mixed methods to look into migration vulnerability and well-being in recent years. And this project in and of itself focuses on well-being during the period of the pandemic, with the focus on well-being in the quote-unquote early months of the pandemic, some from March to September 2020. So as I mentioned earlier, the data that we are using is about the service users from the Doctors of the World clinic, and we have data from January to September 2020, but the period that we are focusing on at the moment for this project is data from the 17th of March 2020, when Doctors of the World moved their clinics from a face-to-face consultations to telephone consultations. So just a bit more about Doctors of the World clinics is that Doctors of the World actually run an advocacy-based program where they provide, and that is clinic-based, where they provide support, information about healthcare and service access, and also provide basic primary care that is delivered by volunteer doctors and nurses. And what happens when individuals attend the clinics, which are referred to as service users, these service users are interviewed by a clinic support worker who then completes various forms during or after that consultation. And that also includes completing questionnaires and also including their own notes and observation. So up until before the 17th of March 2020, Doctors of the World would provide their service from the clinics and face-to-face. But what happened is that from the 17th of March, they've moved all of their consultations to telephone consultations. Which also does mean that, unsurprisingly, as you will see later, this has also led to a decrease in the number of consultations that Doctors of the World have been able to do during that period. So in terms of the forms that are completed during those consultations, one form that we are focusing on is what we call the Social Questionnaire, which includes various information about the people visiting the clinics, so the service users, and that involves information about their demographic information, immigration situation, health coverage, and barriers to accessing healthcare. What we also have access to in terms of data is anonymized consultation notes from the months of April and July 2020 that allows us to contextualize some of the findings from the analysis of the questionnaire data, which means that, again, for this project, what we're using a mixed methods approach that is driven by analysis of the quantitative data, but then the qualitative data provides a more context to our results. So if we are thinking about the general picture of what we've seen from analyzing the data, is that, well, from January to September 2020, we have information about 750 service users, but only 322 service users were seen during the period of the pandemic, what we call the period of the pandemic, between the 17th of March 2020 and the end of September. And from analyzing some of that data, what we actually are seeing is that, more or less compared to previous years, or even compared to earlier months in 2020, Doctors of the World has only been able to see about 30% of its usual number of patients, monthly patients, since moving from a face-to-face consultation service to a telephone consultation service, which does raise some interesting questions about who are the people that they have actually been able to reach with the telephone consultations, and what this means in terms of exclusion of certain service users and thinking about issues of potential digital exclusion and how people are able to reach the service or not. If we are looking quite quickly at the demographic characteristics of the service users who've used the Doctors of the World consultation service, during the pandemic, there's been an even split between male and female service users, which is something that is consistent with earlier picture. Something that is slightly different in terms of the service users is that during the period of the pandemic, over half of the service users who consulted with Doctors of the World were classified as young adults. So when I mean young adults, I mean individuals between the ages of 18 and 34, which represents a difference from earlier on, where the demographic of this age demographic is slightly older. Just as prior to moving to telephone consultations, over 90% of service users are living under the poverty line, which is something that is consistent with the prior picture and picture from previous years. A large majority of service users are London-based, given that most of the clinics of Doctors of the World are actually London-based, even when they're face-to-face. But they used to have traveling clinics as well as clinics in Brighton, and there's also been recently a clinic in Birmingham that was open. But most of the people consulting with Doctors of the World are London-based. Something that's been quite interesting in terms of access and for individuals is that during the period of the pandemic, fewer service users were those without health coverage. So there's an increase in the percentage of people consulting with some kind of health coverage, but requiring support for primary care access mostly, or other issues with some kind of health coverage. In terms of the immigration status, there are different types of immigration statuses that we can identify in the data, but because the small sample size, we are differentiating between three types of immigration statuses. One is undocumented migrants or people without a legal status, asylum seekers and refugees, and people with other types of immigration statuses. And what we find is that during the pandemic period, there's been an increase in the proportion of asylum seekers who have consulted with who have used the Doctors of the World consultation service. And I think even if we think about our own experiences with well-being during the pandemic, we'll find that unsurprisingly, there has been an increase in the shared service users that are reporting bad general health, so worse well-being, and that is especially the case amongst asylum seekers. So for today's presentation, what I wanted to do is so now that we've had a bit of a demographic, is just try to think a little bit about the types of the consultation needs of individuals using the Doctors of the World service. So here, the word cloud that I'm presenting here shows the main reasons mentioned as to why people use a service. And the most often mentioned in the data are actually help with GP registration, also access and charging in terms of secondary care in the UK, information about antenatal care and termination of pregnancy, access and issues with accident and emergency or walk-in clinics, also help with NHS costs, and general immigration advice. And what we are seeing from an analysis of the notes from the different consultation is that in terms of GP registration, a lot of service users need GP registration for a range of health issues that range from having no issues at all to kind of needing GP registration to high needs or more complex situations, including during the period of the pandemic, trying to get the classification as extremely vulnerable in order to access help and services provided. A lot of service users requiring GP registration had been in the UK for years, never really needed GP help, or had actually been refused GP registration, which is a recurring theme when looking at the data. And some of them have also accessed some services privately, but also needing to access the public GP service. And some of the needs that have been highlighted from an analysis of the notes include getting help with the renewal of prescription medication, sometimes urgent, using the service to get referral for mental health. And also there have been some service users who have had COVID symptoms or symptoms that could be COVID, trying to get help and trying to get registered with a GP to get the support, or actually have been affected by COVID after experiencing it. What we've noticed from the data is that GP registration does tend to be a recurring theme even before, but then that also means that this is an area where not only there are some consultation needs, but there are also some important barriers that people are encountering in trying to get GP registration, where this is something that should not be present, at least in the UK context. So when we're thinking about the needs, we also want to look at the barriers that have been encountered by service users with regard to accessing primary care, or even trying to get access to secondary care. And in the data, what we see is that the most often mentioned barriers encountered by the service users include the lack of understanding or knowledge of the system. And that's a link to understanding how the system actually works for charging, for access, for the registration, but also especially accessing antenatal care for pregnant women. There are quite a lot of administrative barriers that service users have been experiencing, especially with GP registration, with practices demanding proof of ID and address as being the biggest barrier for some service users, especially those who may not have a fixed address, for example. But this is mostly resolved by Doctors of the World engaging with GP registration officers and providing a letter in lieu of a proof of address for the service users. There have been administrative barriers in terms of providing forms of ID for a lot of service users that's being asked by GP surgeries. And there's been evidence from analyzing the notes in that that a lot of service users had been refused registration by GP surgeries on the rationale that GP surgeries do not register new patients due to COVID, or also sometimes having issues in accessing the staff at GP surgeries, or even having IT or access issues in terms of using online systems. Other barriers encountered that are more often mentioned are, well, a fear of arrest or immigration enforcement on the part of individuals and trying to get to GPs or even trying to get to the hospital. Because there are a few that worry about the Home Office finding out where they are if they are in a precarious situation. There's also been some language barriers mentioned, language barriers in terms of trying to negotiate, let's say, IT systems or even speaking to GP receptionists, and linked to issues of needing interpreters, or also issues of confidence in speaking English to the frontline workers. Of course, another barrier that's been encountered by the service users during the pandemic has been the ability to pay for, let's say, medication of secondary care, which arises for certain individuals. And some people who have actually been managed to afford this have actually tried to access healthcare privately. Yet at the same time, if we remind ourselves of the fact that about 9 out of the 10 service users have a low income, this will be quite difficult for them to access care privately or even pay for public care. So there are many barriers that have been encountered, many needs for service users, most of which can be have been resolved by using the Doctors of the World service, who try to either signpost individuals to appropriate service or actually help with GP registration. But from analyzing the data, what we also see is that this can be quite a lengthy process, even with people who have a high level of knowledge and understanding of the system. So lack of understanding could be a barrier, but even those barriers, there are still other barriers that are there, even for people who know how to negotiate the system. And it does highlight the needs of some of the people who are most at risk of vulnerability, and especially during this pandemic period. And it wouldn't be surprising if we were to analyze data from October onwards that these barriers are still there and still persisting, and trying to be able to identify the barriers that may arise and that need engaging with. So what we find from this preliminary analysis of the data is that we have some interesting insights, and it's interesting insights in terms of analyzing the availability of the service, a service that is quite important, especially for those at most risk of vulnerability, who might find also themselves more excluded from mainstream care. But there are potential issues that we can highlight. And one of them that is quite important is with regard to digital exclusion in terms of being able to access either the Doctors of the World service or even GP services. And that could also be linked to aspects such as destitution. What it highlights is that there clearly has been an impact in terms of outreach for services like the one provided by Doctors of the World, and trying to be able to reach out to as many excluded individuals and groups as possible. But then the move to telephone consultation has had a bit of an impact on that. And of course, there are some important needs and barriers that have been encountered by individuals, which have probably continued since September, as I've just mentioned, and might have also been exacerbated as the pandemic and the lockdown has gone on. And of course, this has all potential impact for the well-being of individuals at risk of vulnerability, and also as well as for public health, if we're thinking about at the moment the vaccination drive and the requirement for and potential requirement to use GP lists to be able to provide vaccination for as wide a population as possible. Barriers encountered with GP registration could be quite important in order to go forward with a vaccination drive. And Doctors of the World are currently working on this to try to ensure that vaccination is provided for as large a population as possible. So that is all from me. I just want to thank you for your attention. If you want to know a bit more about the project, Doctors of the World, or have questions for myself, you can use this information. We'll also put it in the chat, because what I want to do is also leave you with this great infographic that we had done after a similar seminar back in November for the Festival of Social Science. And this is a figure that's been drawn by the wonderful Pen Mendoka on the migration vulnerability during the pandemic. So you can see what's been discussed. And these are also topics that we're happy to discuss during the discussion. Thank you very much.
Thank you, Laurence. Very perfect timing. And I forgot to mention that we will go ahead with two presentations first, and then we'll call upon you to we'll start a Q&A session. And if you have any questions, you can put in the chat. So, while you have questions, you can just write it down. Okay, the next presenter is Dr. Jotaro Kato, and I don't need to have a bio sheet in front of me to introduce him. Dr. Kato is a research associate at Institute of Asian Migrations at Waseda University, and his research has been on the most vulnerable migrants in Japan, which his dissertation was on the undocumented, unauthorized, or irregular migrants in Japan. And he's currently investigating in particular, the Vietnamese technical interns and how pandemic has influenced their well-beings. So Dr. Kato, please go ahead.
Thank you for your introduction. I'm Jotaro Kato. Very nice to meet you all. Today, I'd like to talk about policy of no policy towards immigrants in Japan. COVID-19 amplifying disparate situation of Vietnamese ex-technical interns. Okay, I need to do it within 80 minutes. Okay, next page. Okay, this is the one of the narrative of my informants. Before coming here, a Vietnamese Buddhist temple in Japan, I have been sleeping under the bridge. Um, he is ex-technical intern and currently without status. And so this narrative is kind of shocking to me. Or in the 21st century, there are people sleeping under the bridge. Then so I tried to explore COVID-19 and Vietnamese technical intern or ex-technical intern. Then one of the issues currently happening in Japan is the number of flights to Vietnam is quite limited. Embassy says they bring 20,000 citizens to go back to Vietnam, but still more than 40,000 Vietnamese who wish to go back to Vietnam are left behind in Japan. Then always I come up with a question from the field. And during I can do the field work for some moments, so I have visited some Vietnamese Buddhist temple in Saitama Prefecture, 80 kilometers from Tokyo. And a non-Vietnamese Buddhist temple always takes care of 30 to 50 numbers of Vietnamese. None have two assistants, but these three take care of the big number of Vietnamese all the time. And most of Vietnamese there were temporal or without status, in other words, unauthorized migrants. And once one leaves by flight, but another comes to the shelter, so they continue to sheltering till now. And here is my overview of the presentation. I'd like to address the result as a policy of no policy of Japanese government on those who stuck in Japan. And also, they want to prioritize continuity of technical internship training program. I will also mention later. And as because today we have many UK participants, so I'd like to briefly introduce what is technical intern training program. Basically, the objective and purpose of this is transfer skills, technologies, and knowledge, to developing in other regions is their official objectives. However, several scholars arguing this is actually de facto import of manual labor. And traditionally, it is also observed as side door labor import rather than learning some skills to transfer. And why I say so often Vietnamese, there are some reasons. You can see the graph of the rapid increase of Vietnamese. 2010, the number is less than 50,000. However, number exceed 400,000 in 2019. That means 10 times in 10 years. So this is very rapid increase. And why I so focus on the technical interns? Vietnamese technical interns occupy 50% of technical interns and also Vietnamese populations. And so I briefly would like to introduce how is the immigration situation in Japan. After August 2020, we can see the some number of technical interns enter Japan. And after October 1st, immigration allowed more new entries from all over the world with quarantine. However, we Japan currently experience a third wave of the outbreak of COVID-19, and the government declared the state of emergency on January 6th, and it is planned to continue by March 7th. And the state of emergency is kind of soft lockdown, but it's much not strict, rather than UK's one. And there are some arguments why we now enter the state of emergency, but why still many foreigners enter Japan? So some criticism happened in Japan. And so MOJ decided to stop the entry of all foreigners after January 22. And this is really interesting. This is entry of Vietnamese technical interns by week. And you can see after January, so they try to enter Japan, they really need to enter, and some stakeholders also want to welcome. So rapid increase after in the very last moment. And so now I try to move to research question. I also visited some dormitory of Japanese language school in Chiba Prefecture, 20 kilometers from Tokyo. And because of COVID-19, of course, it is really difficult for this school to have a new student. So many vacant rooms of the dormitory are there. But still there are some Japanese language school students there. But it's really interesting to see they also accommodate two other types of the people. One is those who wait for the flight to Vietnam, including many disappeared ex-technical interns. Some remittance company representatives donate money. Then so this Japanese language school get money to accommodate this vulnerable population. And number three, I really surprised on that. There are also now so this Japanese language school rent this dormitory to some organization of technical internship. Then newly arrived Vietnamese technical interns actually do the quarantine in this dormitory. And some of them start their training after quarantine. And I totally become panic. What? Why do newly arrived people exist here? I'm really surprised. Then I construct this research question. Why Japanese government chose to accept new Vietnamese technical interns despite there being over 40,000 Vietnamese stuck and are employed, many are employed in Japan due to the pandemic. Then I would like to utilize the concept of the policy of no policy. And there are several studies on that, and especially studies on Roma migrants in Scandinavian countries are interesting. Because of so Scandinavian country also ratified to the EU, so they cannot deny the entry of the Roma. However, the Roma staying on the street is kind of distracting to the citizens of the Finland. So the presence of legitimate yet unwanted EU citizens outside labor market has produced policy dilemma. What has in practice emerged is a policy of no policy. So they just try to reduce the difficulty of them, but they do not do the take the very strong policy on them. I'd like to utilize this concept to my observation too. And here is a number of my data related to Vietnamese. And I would like to focus on Vietnamese ex-technical interns. That means who already finishes their technical internship 3 or 5 years. And 5 are unauthorized migrants. And 5 are, they already finished technical internship, but they still have some temporary status rather than technical internship. And I also would like to utilize the several data of technical interns who still have a status. And research result, the Ministry of Justice temporary measure of unemployed technical interns who had finished their internship during COVID-19. If technical interns who completed internship could not find the work in the same industry of the technical internship, immigration gives the legal status called designated activities, 6 months without work permit by the end of November. And immigration finally starts a new permit from December 1st. If there is any difficult condition to sustain living, of course, it's difficult. MOJ will give part-time work permit to them within 28 hours per week. So I observe, so not to settle in them, but just to let them stay is the intention of 28 hours is my assumption. And research results. Young and ex-technical intern who currently have temporal status, 30 years old, experienced finally he goes to the shelter because of no policy in October 2020 when I had interviewed. So he completed his technical internship in March 2020 in west side of Japan. MOJ gave him temporary visitor visa, same as a tourist, and he needed to extend every 3 months. Of course, with this visa, he is not allowed to work. And so this happened March and October, so 7 months is already passed. And so he tried to find a solution by himself. And he visited his friend's house every day. And he met some Japanese people to into some part-time working opportunity. But he don't have any work permit yet. So he running out his spending. So he asked to Tokyo Regional Immigration Bureau for work permit freeze on October 6, 2020. But of course, this is denied because immigration have not started part-time work permit to this population. Then he wants to stand by himself, but he finally needed to ask private shelter to protect himself. So another narrative from Luan, he is also ex-technical intern who still have a temporal status in his late 20s. And he actually fired by construction companies during the technical internship because of the recession by COVID-19. But technical interns are expected to taken care by supervision organization. However, that organization did not do anything to him. And after he also running out of money, he went to some branch office of Regional Immigration Bureau to ask 28 hours part-time work permit because it is already December, so it's possible to get that one. But the branch just kicked him out, yelling, "You're a super young organization should take care of you till your departure." So he cannot do anything on that day. However, he got an advice from some temp agency to go to Tokyo headquarters. Then he finally get a temporary visitor visa, thanks to the advice of some human resource agency. However, I can easily observe, so once migrant experience the terrifying thing in immigration, he or she do not want to come back to the immigration again. So he is strong enough to go to immigration again. But this kind of unkind attitude also affects the vulnerable situation of this migrant population. And also I can observe the institutional barriers on that. So MOJ, of course, do something. So had studies the matching of employment to this population. So those who are stuck are more than 40,000. However, the number of successful cases was less than 2,000 in January 2020. And this is the institutional barrier. Yeah, for applying this MOJ matching, ex-technical interns need to hand in the document from supervision organization. But aforementioned Jan said, "I cannot get this paper from my supervision organization." Of course, there is some reasons. Supervision organization's income is by supervision fees from companies which accept technical interns. So if one company accepts one technical intern, each company needs to pay 25,000 yen to 50,000 yen to supervision organization. So this is a source of income. So of course, supervision organization want to focus on try to get a new technical interns rather than supporting these having a difficult situation. So there is no merit for supervision organization to incorporate this employment maintenance. Then, but on the other hand, both stakeholders and immigration are really enthusiastic to welcome new people, as this graph shows. Then, so I'd like to say policy of no policy on those who are stuck in Japan. MOJ does not know the exact number of those who are stuck in Japan, only know the number of those who change their legal status. So they do not try to understand the situation correctly. And the government has not offered shelters yet, even though thousands of people are has faced difficulties, then this kind of burden comes to the private sectors. And MOJs allows those who are stuck to work for 28 hours a week. And I can say this, they just want to alleviate the burden, but they do not want them to settle in, and also not to let immigration policy in Japan. And they prioritize the continuation of technical training program. So actually, so technical interns program along with Japan's no immigration policy attitude. And if so, once they stop the flow of the peoples, it's difficult for intermediaries to survive. So to let intermediaries survive and to continue this system, anyway, they need to start running on the system. That's why they prioritize continuation of the program. And actually, I'd like to say technical training internship is kind of the match with Japanese intention. Here is the demography of Vietnamese in Japan, the end of 2019. And you can see the concentration on the working age between 90 to 39. So when they circulate, so Vietnamese technical internship is a perfect match to Japanese government. However, COVID-19 happened, and they suffered they cannot come back to Vietnam. And I'd like to discuss stack of 40,000 lives is not small number. It will become risk in the receiving country, Japan too. Actually, after October 2020, so crime on Vietnamese appear on the television and the newspaper so often, especially the case of some Vietnamese ex-technical interns slaughtering the pork in his apartment, and he is arrested on that. First, people put assumption, oh, these Vietnamese should store this kind of fruits and the porks. And so attitude, stigmatization happens to Vietnamese after that. And I also assume it will also discourage bad rumor. I had a really difficult time in Japan. That kind of narrative would affect new Vietnamese to come to Japan. But of course, I need to do the further research in Vietnam to clarify that. And COVID-19 make institutional barrier in TITP embossed. If so, there only the government and technical intern exists in Japan, government might can take some measures. But because of too many actors are involved in this system, so it's difficult to enact rapid measures. And so I'd like to finally address, it's time to discuss immigration policy to guarantee safe migration. Even though Japanese government do not want to go to migration policy, at least circulation of labor from beginning to the end. Okay, it's 80 minutes. This is my end of presentation. Thank you for your attention.
Thank you, Dr. Kato, for perfect timekeeping. So I don't see any. Okay, I don't see any questions in the chat. Yeah, the chat column yet. But if you have questions, you're welcome to raise. You can also type here, or you can also I can also see your names, and you can raise your hand. Okay, I see one hand. I only have your email address, so the first is a okay. How should I address you? Please go ahead. Folgerman, and I'm sorry, I don't have your name. I only have your
Tatiana Fogelman.
Okay,
Can you hear
yes.
me? Yeah.
Yes.
Hello, everyone. Thank you so much for your presentations. We're starting with some colleagues a project in April on also on COVID and vulnerable migrants, but more focusing on the sort of the kind of interfacing with urban governance. I have a question for you, Laurence. I know you focused on spring, but I'm wondering whether has there's been any learning, whether you have anything to say in terms of sort of learning in reaching this organization that you focused on. Have they has there any learning happened between these different stages? I mean, we've been in the situation for a year now in terms of how they might be reaching out more of their more of the client base, or however you refer. Like, is there any kind of active outreach? I mean, and how that has changed between these different, let's say, lockdowns or throughout the pandemic?
Yeah, thank you very much for the question. That's something we've not discussed with them really, and something we'd be quite interested in looking at is really seeing and that's something that we'll try to push a bit forward in terms of the analysis of who are the people they've been able to reach out to and not able to reach out to, because there seems to be some kind of differences in who have been able to access the service, and try to inform that a bit further. But these are discussions that we're kind of having at the moment with the organization, because I think it raises very interesting questions, and this whole discussion on kind of digital exclusion of who can access a telephone service and who cannot access telephone service, I think is really important. The same way it is important in terms of the increasing focus on using online services for GPs as well. I think that's definitely a focus of work that we'll definitely be interested in expanding further. Thank you very much.
Mm-hmm.
Thank you. And Mika, very good to see you here. Yes, please go ahead.
Very nice to see you. And I think I met Kato a long time ago as well.
Yeah.
Yeah, thank you very much for very interesting presentation. And I think you have focused on the left behind, but I'd like to know who actually managed to return as well. Like what kind of procedure they have gone through, and who were left behind and who are being selected to go back, and who are involved in like the actors or intermediary in these procedures. If you can tell us a little bit about that procedure. Thank you very much.
Thank you so much. Question for Professor Toyoda. Nice to see you again here. Actually, so Vietnamese embassy launched mail form to get a request from Vietnamese citizens to go back to Vietnam. And also, I heard more than 50,000 requests come to the embassy. Then, of course, but because Vietnam had a really strict policy to let people in to prevent from the infection of COVID-19, that's why many cannot go back. But so those who can come back to Vietnam, actually they have some priority on the female who actually pregnant right now, and also who had serious diseases, and also whose parents passed away, or whose parents are really crucial situation in health. These people are prioritized and go back to Vietnam. However, several of my informants say even though his parents already passed away and he put a request, he's still here in Japan. And what I actually observed is, actually I introduced at the beginning, Vietnamese shelter run by Vietnamese Buddhist temple. Actually see also becoming the role of the intermediaries to introduce those who need to go back to Vietnam. So according to the narrative from them, they had some recommendation or petition from this nun. So embassy understand the situations, and they are more easily go back to Vietnam. So what I want to say is of course this shelter do the very great stuff, and I really admire their work. But also they also become the function to find the people who really need to go back to Vietnam and connect these people to Vietnam. Yeah, this is actually observation for now.
Thank you. We also have a question in the chat. Naoko, would you like to raise the question yourself, or should I read the question?
Mm-hmm.
So question.
Yeah, you can just read my question. I mean, maybe it's easier for the the panelists to read the questions and then maybe answer. I think in my view, it's already said. Huh?
Okay.
Mm-hmm. Okay, I just read the question. Thank you. And shall I say something on that?
Yes, please.
Yeah. Actually, so I think you might know in MOJ, so changed its institution from beginning of the 2019, and they so becoming the immigration service agency. Then they have two branches, and one is branches to take care of the lives of the foreign citizens. And immigration MOJ tried to so take initiative for the lives of that. That's why this types of matching services are done by MOJ is my understandings. And I might criticize a lot today, but what I want to say another stuff is I think that by the COVID-19 becoming some chance to local government to involve in this kind of situation. For instance, of the case of the Tokyo, so Tokyo metropolitan government asked to some civil society organization to launch their telephone services to consultation on COVID-19 matter for foreign citizens. So on the national level, so I think there are still many things to tackle on. But on the other hand, so many people try to so bring the new services and the new connections and the new schemes on that is my observation on that. So hopefully so I answered your question.
Yes, thank you. We also have a couple of questions in the chat and one hand raised. So I will just go to this first chat question first, very quickly. Regarding the situation that supervision organizations for Jotaro do not take care of the technical interns who cannot go back to their own countries, do you think it would work if we can change the regulations to make supervision organizations to take responsibility for taking care of the trainees until they return, or should we fine them if such problems happen? So should we regulate basically the supervision organizations?
Okay, thank you. Question, Ms. Iwashina-san. Yeah, so yeah, actually, so even though currently supervision organization did not do anything to them, so there are no penalty yet, and there are also no obligation for them to do that. Then so some supervision organizations do the really nice job, but on the other hand, so many of super organizations, of course, to survive for them, they need to get money. So I understood they put the priority on recruiting the new people rather than take care of those who are left behind. However, the number is really big. And if we leave this number, it's not good to sustain this scheme also. So hopefully, so not fine, but at least, so I think regulate them by obligation is needed, at least is my opinion on that. Thank you for your question.
Thank you. And also Mariko Hayashi has also raised hand. Mariko, please go ahead.
Hi, yeah, thank you so much for your presentations, and nice to see my familiar faces as well. My question actually is a quite broad one, but just hearing that Jotaro-san, you're saying like, this might be an opportunities to kind of shift how the policies run migrant workers, especially TITP. And because I'm currently in the UK, I also work with the precarious migrants here in the UK. And I know that a lot of problems comes from kind of the long-lasting fear towards all these kind of citizens policing and all that kind of hostile environments where people are really scared of accessing any kind of support available. And I know that because of the vaccine rollout, there's an encouragement for people to register with GP, but the people I know, they don't believe that, they were still scared. And I just wanted to know that in the both context of UK and Japan, would you think that this is something, an opportunity to kind of shift that way that the societies and the policies, the government has treated these precarious and vulnerable migrant populations? Yeah, that's my question.
Go ahead, Jotaro. You're muted.
Oh, sorry. But the question is both for UK and Japan. Okay, I try to do very briefly. But I might need another session to talk, but actually MOJ so tried to revise its Immigration Control Act in this diet. And actually, so the most of the things to revise is more punish overstayers or undocumented migrants. So for now, at least the MOJ stances on these vulnerable population, I think it might be difficult for MOJ to change their attitude. That's why I want to introduce the fact and what's happening on there. So this kind of symposium and also like a media's report. So by various ways, so we should let them understand we also take care of the vulnerable populations, and it will become the risk to sustain technical intern program which government preferred is a kind of the argument I would like to raise. Thank you for your question.
Laurence, to
Yes, very quickly. I think there are opportunities in terms of the UK of trying to, but I think the opportunities could go two ways. So opportunity of trying to get over the quote unquote, I think, trauma of the hostile environment and what that has created, and trying to increase access and make things clear about where the access is legally, people have legal entitlements to it, and trying to kind of lessen the trauma and the stigma that has been associated with the hostile environment. At the same time, I could also see how this could also lead to potentially an increase in oversight. So either, I'm not entirely sure in which way it would necessarily go. So there are two different potential routes and how this is being dealt with in the context of the hostile environment in the UK.
Okay, I have several questions here. I think there's one question for both Laurence and Jotaro. I think we'll wrap this section up with that question. And this question is from Emily Mori. What role do cities of sanctuary play in working with precarious migrants in the UK or Japan? Do you have any response to that? So this is a question for both of you. So do you see the roles of sanctuary, cities of sanctuary?
If I may, so it's not something that we've necessarily explored, but there's definitely, there is opportunity for different endeavors, such as cities of sanctuaries, or you have the work of Doctors of the World, we have the Safe Surgeries Initiative, to ensure that everybody gets registration with a GP. And so there is a role for these initiatives and organizations to try to ensure the inclusion of more population at risk of vulnerability, but it's not something that we've looked at specifically, but definitely there is scope for action in that area.
Right, and also.
May I?
Yeah, go ahead.
Okay, so actually I have been to US and I know that what is sanctuary city, but in Japan, compared to UK or maybe UK, the local government, authority of local government is so weaker. However, so I can see some cases of for instance, Warabi city, like 30 kilometers from Tokyo, which accommodates many Kurdish refugee applicants. So like a petition or opinion paper to national government because they have more than 2,000 Kurdish refugee applicants who cannot register that city, but exist. So try to soften the refugee recognition on that kind of population. So these kind of things are start to be observed. But basically, it's difficult to utilize sanctuary cities concept to Japanese local for now.
Yeah, thank you very much. And the final, very practical question from Nando Jotaro. Are there any, so will the technical interns and precarious migrants get vaccination? Any discussion?
Okay. I think so. Today, so we have several medical people here in Zoom, and I think so. This should be better to let them answer. But from me, I think because Japan is really very beginning stage of the vaccination, just for medical practitioner for now. So I think so. We need to wait for the discussion. But at least technical interns, yes, if they have a legal status, they definitely can take the vaccination. But discussion on the irregular or undocumented migrant, they are actually excluded for now. But of course, this will become the risk if they are just walking around without vaccination. So we should still take into account for that.
Yep. Thank you for the response. And we actually have some more questions, and I will cut paste them and send to the two presenters after the presentations. But we try to make our discussion more compact, and we'll make this section more sustainable. So we make it just 1 hour and just enough for everybody to concentrate. And Anne has just put up advertisement for next ARIS webinar, which is Romani communities in the new social Europe, so solidarity, empowerment, and anti-gypsyism, so which will be on the 26th of March. You can go through the questions in the chat and find this particular announcement. And also, I would like to announce that our Node webinar, this is the first one, and thank you all for being here with us. And we'll have a next one in 2 months, which will be April 21st. And Jenny Phillimore and I will present. I think Jenny is going to talk about, I have it here, we are forgotten, forced migration, sexual and the COVID-19. And I plan to talk about the Nepalese restaurateurs and the cooks during the pandemic, and talking about the structural vulnerabilities of immigrant entrepreneurs in Japan. So we hope you will be interested in our next session as well, and just keep we will keep you posted. We'll send announcement shortly later. And thank you all again for being here with us. And I want to thank two presenters for two wonderful, very informative presentations and starting our webinar series. And so thank you very much. And looking forward to seeing most of you in our next webinar.